In May 2016, a devastating new virus appeared in Australian pigeon lofts, first in Western Australia, then in Victorian lofts. This new disease was highly contagious, spread rapidly, and caused very high mortality. Initial testing quickly ruled out known pathogens such as paramyxovirus, E. coli, and adenovirus. As various Australian avian vets and scientists rushed to make an accurate diagnosis, fanciers were encouraged to lock down their birds and enact strict biosecurity procedures to help prevent spreading the new illness. Without enforceable rules and widespread cooperation, however, the virus continued to spread through racing, fancy and backyard lofts, as well as to wild and feral pigeons. The disease reached Sydney in January 2017, then hit Queensland and Tasmania 3 months later. Initial diagnosis work with this mysterious new virus pointed towards a reovirus, and this line of investigation soon uncovered the true identity of the bug, a new rotavirus, classified as a type A, subtype G18. Rotavirus is indeed a type of reovirus, and this was an entirely new mutation that infected domestic pigeons. With an accurate diagnosis made, the fanciers looked to the experts for treatment options and a vaccine. As a vaccine for a related rotavirus that affected cattle was already approved for use in Australia, it was hoped that this vaccine would be effective against the new pigeon virus. However, this unfortunately proved not to be the case. It became clear that this new mutation would require its own vaccine, and work began to create one. During 2017, many fanciers, as well as racing and exhibition clubs, chose to cancel their events in an effort to prevent the disease spreading during the vaccine development. Others, however, chose to continue, and before long, the disease was endemic Australia-wide. In early 2017, a milder strain of the virus appeared in Brisbane. This strain caused far fewer mortalities than the original strain that mutated in Western Australia, and also conferred immunity against the more severe infection. Some fanciers, desperate to protect their birds, began distributing the Brisbane rota among members in their clubs. The milder version of the disease was intentionally spread through infected droppings, colloquially known as poo-vac. The development of a true vaccine was slow. However, in early 2019, it began to be distributed to fanciers. The vaccine is administered in 2 separate injections, 4 weeks apart. It is not recommended to vaccinate for paramyxovirus on the same day as the rotavirus injection. As this is a new and experimental vaccine, it is not perfect, and some breeders have reported infections in previously vaccinated birds. It does seem, though, that vaccinated birds suffer from much milder rotavirus symptoms. As rotavirus has an incubation period of about 5 days, initially nothing happens when the birds contract the virus. After the incubation period ends, rapid onset of the disease begins. Infected pigeons begin vomiting up their food, develop green diarrhea, and settle into a hunched, panting position. When infected with the most virulent strains, up to 50% of the pigeons in the loft may die within 24 hours of their infection becoming evident. Infected lofts will continue to show symptoms for 5 to 7 days, as the virus works its way through all the pigeon residents. It is important to note that survivors of the virus are able to pass the disease onto other non-infected pigeons. Research has shown that for up to 15 weeks after recovering from rotavirus, previously infected pigeons who appear healthy may still be active carriers, spreading the disease in their droppings. Survivors of rotavirus also often do not come away unscathed. This virus is capable of causing permanent liver and internal organ damage that can impact the pigeon's racing ability for life. Pigeons lucky enough to survive a rota infection do develop a temporary immunity to the disease. However, this appears to begin waning after about 10 or 12 months in some birds, and they are then able to be reinfected. Because of this, an annual vaccine booster is recommended to provide full protection. There is no specific treatment for pigeon rotavirus apart from vaccination. Fanciers are encouraged to, where possible, engage in strict biosecurity measures to avoid infection of unvaccinated birds. Where practical, only vaccinated birds should be sent to races or exhibition events. Fit and healthy pigeons are more likely to survive an infection, and there are some measures a fancier can take to help minimise mortality if infection occurs. Suspected virus carriers should be isolated from the flock for at least 7 days. Some breeders have found that a diet of pellets rather than grain help prevent the virus spreading through vomited food in infected lofts, and hand feeding of infected birds can help them get through the disease phase. It is very important to ensure infected birds are well hydrated and electrolytes are helpful. There is also some evidence that antibiotics may help prevent opportunistic secondary bacterial infections during the rotavirus infection. Antibiotics, however, do not have any impact on rotavirus itself. Australian pigeon rotavirus is now endemic in the country, and it is unlikely to ever be fully eradicated. Likely the disease will eventually spread worldwide. Biosecurity measures and vaccination can help slow this spread and protect valuable stock from this severely infectious and deadly disease. This video is the first in a series on diseases that affect domestic pigeons worldwide. If this video has been helpful to you, please press like and consider subscribing for more.